There are very many nice things I can say about Cybele. She knows, but I love her energy. She is so present. The guidance has been there constantly. She began mentoring me before I came here. She was so excited. I could feel the excitement right from, Kenya, and she was here. It was very palpable, yeah?
A lot of what Ombeva said I would say about him. I mean, I think something, and I believe within everyone involved in SASH has remarked to me about Ombeva's energy and positive attitude and enthusiasm and love of being here. It's just this incredible energy that energizes me. So I think a lot of what you see in me, it's because of what I see in you.
My name is Ombeva Malande. I'm a pediatric infectious disease specialist. So that's kind of a doctor who treats children who have infections. Yeah, and from Kenya, the western part of Kenya, Eldoret City, where the marathoners come from. And I work in a hospital there called Moi Teaching and Referral Hospital. So it's the teaching hospital for Moi University. And I'm a teacher there, and I also treat sick children there. I love global health because the vast majority of problems that we face are infections, yeah? And so you really couldn't assure health of the globe if you don't address the infection question.
And I'm Cybele Renault. I'm one of the infectious disease faculty at Stanford, and I do all of my clinical work at the Palo Alto VA. And I run the global health program for the internal medicine residency program. And probably the biggest thing that I love about global health is just seeing sustainable ways that programs can be developed, and ideally within partnerships and ideally within education.
In Africa, where I come from, sub-Saharan Africa, if you may, biggest drivers of illnesses and deaths in our hospitals are deaths among children under 5 and among pregnant mothers. And all these are largely brought to hospital because of infections. So that's why, for me, infections and resistance to our current drugs that treat those infections, or resistance to vaccines that would protect those infections, are serious passions of mine.
And my work here and overseas is really focused on antimicrobial stewardship programs. So at the Palo Alto VA, I am co-medical director of our antimicrobial stewardship program. And I actually started our antimicrobial stewardship program 15 years ago. And that was many years before President Obama mandated that there be an antimicrobial stewardship program in every hospital in this country because of the crisis that is antimicrobial resistance.
SASH provides a timely help and opportunity for something very big. We've realized that a more sustainable way of this stewardship program would be to embed in it an infectious disease consult service and an infectious disease fellowship training program, and then a strong infection control program, both embedded right into this stewardship model that we are developing. And that makes it, one, very unique, but two, sustainable beyond just this project. Because then when you have fellows on ground and you have a very effective consult service, these will be able to sustain the stewardship program for very many years. And that is a very unique thing. The Eastern Africa region has close to 500 million people. All those countries, none of them has a pediatric infectious disease fellowship program. So if we start this program, we are offering opportunity to close to 500 million people to be able to have specialists trained to deal with their biggest problem when you're looking at healthcare. And what we are doing between Cybele and I is pretty much what is being replicated in 24 other arrangements in the SASH program. Because this program is about 24 different scholars each attached to a mentor. So these interactions and the synergy and the kind of work that dreams and hopes and aspirations we have here are going on 24 other times this year and going into next year. I mean, it's an amazing program. You get to think about this. You have this happening in Eldoret, it's happening somewhere in Ethiopia, it's happening somewhere in Nigeria, it's happening it's like elevating literally the whole continent of Africa.
I think something that makes our partnership really unique is that I've been working in Eldoret for 3 years now.
Yeah.
It's amazing. Yeah, I've been there
Beautiful.
twice.
Yeah,
It's an amazing thing. I went first in 2022 and I did not expect at all to fall in love with it. And it's amazing. So I met the 2 adult infectious disease physicians there very early in my stay. And I said, what are you working on? Like, how can I be helpful for you? And they immediately said, like, we're trying to build this antimicrobial stewardship program. And it was like serendipity.
And because of that, we've been able to build relationships. And so she's able to even continue that mentorship, even when she's this side, to continue to just contribute to what we are doing. Baby steps, if you may, but I think we keep adding one brick at a time. You know, we put the cement, add a brick, let it dry, add the next as we build something. And I know because of that and her continued work now, and now that added into the larger environment and opportunities that this program provides, I think we should be able to achieve something long term. From where I sit, this opportunity, if for anything, it has, to me, restored hope in the world and promise, particularly in the climate where we live in this transition, with a lot of worries and concerns and cares. Where are we going? Are we reaching the death of science, what we never imagined? Now we are in a place where we are not so sure where we are headed. And even the whole issue about global security, it's when there are outbreaks of Ebola, of Marburg, of what. Those are national security diseases. People could transmit them by moving across countries. And if we do not get the support we need, then we're in a very dark place. Because when you have an outbreak, then the diseases can spread without, and then everyone becomes at risk. And COVID did teach us this, that when one is unsafe, no one else is safe. Everybody is unsafe. So it goes beyond just treating disease. It's a security issue. It's a hope issue. So in that kind of uncertainty world where we live today, there's such a shining light of what Stanford is doing as collaborations between the global north and the global south. There's a north to south collaboration. And these are initiatives that need to be supported, that need to be funded, that need to be nurtured. And Stanford is providing a star that we can use even when we think the light at the end of the tunnel has been switched off.